Okay. So let me know that if there is any difficulty in seeing. Okay. So good morning to everyone, and very nice to interact with you and talk to you as you're starting your important career in the medical profession. The important degree, even though it's a basic degree, it's a very important degree. It's a foundation for all the thing what you're going to achieve in the future. So it is necessary to plan your life because and the MBBS is basically initially you're seeing basic science, and subsequently you'll go to clinical medicine. Basic science is very, very important because if you see all over the world, most of the researchers are very strong in basic science. So we should not think that basic science we can just read and then we can go to clinical medicine. And as we are going to become a clinician, then it's not that important. So basic science is very, very important. Whatever research you are going to do, whatever clinical practice you are going to do in the future, whenever you're traveling abroad, it's very important to have a very deep knowledge of basic science. The foundation is very, very important. And second thing is your life is not going to stop with MBBS. You're going to do post-graduation in the future. And most of the examinations are competitive examination you're going to face. So while reading the basic science itself, you also simultaneously read multiple choice questions, and you also prepare yourself for the what question can be asked, what answers you have to give in the first year itself, so that when you come to the house surgeon, you don't need to stress yourself for preparing for the competitive examinations. So start the first year with full swing, balance your life, don't overwork, work normally every day, so that you can perform much better, you can achieve more heights in the future. That's very, very important. It is a noble profession. That's because that you will get your livelihood. At the same time, people appreciate you for what you are doing to them. And so it is it's highly respected profession. I don't think in the near future also it loses importance. So without medicine, so from the humanity, beginning of humanity, treating a suffering is very, very important, because health, education, and basic needs of life are always very important compared to other things in life. So I don't want to give too much advice to you, and all of you are grown up and you know much about life. And but keep one thing in mind, that and start working from the day one, and have interest in the profession, and have a passion for profession, and work from the day one, and learn with interest, as well as study for acquiring knowledge. It is not about memorizing the subject. You have to understand, and you have to acquire the knowledge. You have to understand the physiology, anatomy, biochemistry, pathology, rather than just memorizing and writing in the. You may get marks, but without understanding, getting mark is of no use in the future. So if you don't understand a concept, read one or two books, find out, clearly understand the concept, and so that you can be much more innovative, much more effective in the future. I just want to touch this topic called sleep hygiene. It is not only for health professionals, it is applicable to everyone. What we see in the current day, that we think that sleep is something dispensable, it's not that important, and we can sleep less and achieve more. It is not like that. It's very important. I'm not going to go into the detail of sleep physiology. I'm not going to talk about sleep disorders. My aim is not to give lecture on sleep disorder. It's a separate field by itself. People do conferences on 3 and 4 days on sleep disorder itself. So my idea is to make you to understand how important is sleep for you, which is very important for you to be healthy, as well as to achieve what you need in your life. Without a healthy body, healthy mind, you cannot achieve anything in life. So first I'll touch on insomnia. I think this most of us would have faced. Not only old people face it, even young people face it. People at some short stage in life, they face it. So you have to understand what is insomnia. Insomnia is a problem with sleep. People with insomnia have trouble falling or staying asleep, or they do not feel rested when they wake up. So even if they get up in the morning, they don't feel fresh. They would have slept in the bed, but they don't feel fresh. Insomnia is not about the number of hours of sleep a person gets. So we think that, okay, I slept for 7 to 8 hours. I slept for 7 to 8 hours yesterday, so I should feel fresh. It's not like that. There's so many other factors are very, very important. Everyone needs a different amount of sleep. Some people say that I slept for 6 hours, that I'm feeling very fresh. Some people say I slept for 10 hours, still I feel groggy. It's very, very important that it all depends upon the quality of sleep, and hours of sleep is not fixed for everyone. But there is a basic small minimum amount of sleep, and you cannot sleep more than 11. Short-term insomnia is a person, when a person has trouble sleeping for a few days or weeks. I think when you're under stress, or when you're working for some exams, or when you have some festival functions, or you are excited, there are people don't sleep for a few days. And, even if they try to sleep, they don't get sleep. It's called short-term insomnia. It lasts for a few days or weeks. This is usually due to temporary stress and often gets better on its own. So that once people get into the normalcy, then it will settle down by itself. So the short-term insomnia doesn't need always a sleeping tablet. Is not the right thing to do. Long-term or chronic insomnia is when sleep problems last for 3 months or longer. There are people come and say, I never slept for past 3 months or 4 months or 1 year or many years. So that is a long-term or chronic insomnia. So anything more than 3 months of insomnia is a long-term or chronic insomnia. What are the symptoms of insomnia? I have trouble falling or staying asleep. So they get into bed, but getting into sleep will take time, or they cannot stay in the sleep for a long time. So they have disrupted or fragmented sleep. They cannot go into sleep that easily. Feel tired during the day. If the sleep quality is not good, the daytime they feel tired. They don't have energy. It's not a elderly problem. It's a problem of even young generation. So the people tired in the morning, they feel very tired. So you have to find out why you are tired in the morning. Forget things or have trouble thinking clearly. So when there is a tiredness, they forget, or they have trouble in thinking clearly. Their brain will not be sharp. The cognition is not sharp actually. They make wrong decisions. They forget things. And they get cranky, anxious, irritable, or depressed. So when they're not sleeping adequately, when they don't feel fresh in the morning, they may get cranky, anxious, irritable, or depressed. So whenever you see a friend, or whenever you see people in the house, or whenever you see anybody else, if you feel they're cranky, they're very irritable, anxious, depressed, don't label them with a personality. Find out what is wrong with them. Now, everybody wants to be nice, everybody wants to be pleasant, everybody wants to be friendly. When somebody is not like that, there may be a reason. We always label the people and say that, okay, you is like that, he's like that. We have to find out why he's like that, whether he needs any help, what we can do to make him better. Most of the time, if we take some effort, at least in 50 to 60% of the time, you can have these people to become normal. So they have less energy or interest in doing things. When they are not sleeping adequately, they have less energy. You see, some people are very energetic. They get up in the morning, they do so many things, they're so productive. You would have seen doctors or any professional, industrialist, other industry, people get up, they work so efficiently, they're so fast, and they're very effective, they're cognitively sharp, they have more energy. So I think all of us, our body, healthy body should have the same amount of energy. Why our body is having less energy? Why we don't have interest in doing things like other people? We have to find out. It is not like we have manufacturing defect or networking issue. We always tell something to get away from the issue. It is not like that. Most of the healthy body should have same amount of energy, and they should have same amount of interest in doing things. Make mistakes or get into accidents more often than normal. So when they are not sleeping adequately, they're tired in the morning, and they are irritable, angry. They'll be restless. They make mistakes. Some mistakes are person is not holding an important post. A mistake is not a big issue if it is not going to affect others. But if people are holding big posts or decision-making jobs, their mistake matters a lot. Or they get into accidents more often than normal. And they worry about their lack of sleep. Suppose I don't know, you are starting your career. I see in my clinic, some people come and say repeatedly same thing. Dr. Pazhani, I'm not getting sleep. I'm not. You would have told 10 to 15 times before you leave the clinic. And he's more worried about lack of sleep. In fact, they make the doctors also stress that I'm not sleeping. What can I do? It's become an obsession for them. Even if they say, okay, you do all these things, they don't wait because it is constantly going on the mind that I may not be able to sleep today night. So these symptoms can be bad that they affect a person's relationship or work life. So when the complaints like lack of energy and irritable, angry, cranky, depressed, and people don't want to be friendly with these people because they want to be in peace actually, so that they avoid them. So that it affects their personal relationships or work life. It can happen to people who seem to be sleeping enough hours. So don't think that if somebody is sleeping for 7 to 8 hours, they have quality of sleep. And it can happen to people who sleep enough also. So you have to find out what type of sleep they're having, where they have adequate quality of sleep. Very, very important. So if you take the sleep hygiene, the topic of today is sleep hygiene. So how can I maintain my sleep hygiene? Sleep only long enough to feel rested and then get out of the bed. So go to bed in time, get out of the bed in time, and sleep in dark hours. That's good for the brain. That's how the circadian is set up in the brain, and you feel that your brain feel fresh and feel rested enough, Then get out of the bed. Don't lie on the bed for a long time also. It's not needed. Go to bed and get up at the same time every day. I think what I see nowadays, because of the electronic addiction all over the world, and everybody is addicted. Not only, we can't blame anybody. The doctor giving advice also addicted. So so that they go to bed in different times. Suppose they start watching a movie at 10 o'clock, the movie finish at 1 o'clock. You go to sleep at 1 a.m. in the morning, and one day you go to bed at 10 o'clock. So brain doesn't work like that actually. You have to train the brain to go to bed in time and get up at the same time every day. Very, very important. I'll tell you what happens if you don't sleep properly. There are a lot of issues are there. It is not simply sleep as you think actually. We are more focused to diabetes, hypertension, cholesterol, heart attack, and kind of things actually, rather about the lifestyle related disorder, rather than how to prevent it actually. And we talk about only again hypertension, diabetes, and all. We don't talk about natural way of living and what important role it plays apart from the common risk factors what we are treating every day. Do not try to force yourself to sleep. If you cannot sleep, get out of the bed and try again later. But I don't advise in all the situations. I have patients who say that I don't get sleep, so I watch a movie, then I go to bed. I don't advise that. What they're advising is maybe you can go and walk for 1 or 2 minutes or 5 minutes and go back to sleep immediately, not watching a movie for 3 hours and going to sleep. That's not what this statement means. And so it's very important that to go to bed in time and get out of the bed at the same time every day. So have coffee, tea, or other foods that have caffeine only in the morning. So if you're having coffee, tea, other foods which contain caffeine, take only in the morning, not tonight while going to bed, because it definitely disrupts your sleep. Avoid alcohol, especially in the late afternoon. Alcohol is not advisable at all because it has its own impact. And I always tell that alcohol smoking, now people say it's a bad habit. Then they say, oh, I'm not a bad person. So it's not talking about own personality. It's a bad health habit. If you want to live happily, you need a healthy body and healthy mind. So unless you have a healthy body, healthy mind, you cannot live happily, whatever you achieve, whatever money you make actually. So for that, you need a clean habits. People should not drink, people should not smoke, go to bed in time, eat healthy diet. So without a strong body, healthy mind, what you can do in life? The property, I'm a qualified lawyer. I always tell that the property what we hold is our body. Our body is our property. Until we die, the body belongs to us. The other properties are called possession of property. It's a legal term. It may belongs to you today. Tomorrow it may not belong to you. You would have seen the empire kingdom shattered down with no money. But the body belongs to you throughout your life. Until you die, the body belongs to you. The property is body. So very, very important to take care of the property, what belongs to you throughout your life. So avoid alcohol, especially in the late afternoon, evening, and bedtime. Avoid smoking, especially in the evening. These are all Western recommendations because people cannot go and tell everybody don't smoke, don't drink, and they are not. They are more concerned about what is really bad for them. But the ideal thing is to avoid alcohol and smoking. You will have a healthy body and healthy mind, and you will not get any vascular disease if you smoke. People smoke, they definitely get some vascular problem in the future. So keep your bedroom dark, cool, quiet, and free reminders of work or other things that cause you stress. So your bedroom should not be a place of watching TV and using electronic items and fighting with each other and like thinking about what happened in the daytime and angry with people and reacting to everything in life. And so if you keep your mind of non-reactive state, keeping cool, peace, calm, a lot of things cannot happen to your body. But so keep your bedroom dark, cool, quiet, and free of reminders of work, other things that cause you stress. Tomorrow work you can do tomorrow. You can plan for a few minutes before going to bed. Don't think about it all the day, because every day is a challenging day, and face the challenge. It's very interesting. Life without challenge is boring. So solve problems you have before you go to bed. As I was telling that whatever you want to plan before you go to bed. Don't lie down on the bed and think about what you're going to do tomorrow and what is going to happen and all those things actually. So get plenty of physical activity. Like do physical activity. Nowadays I see people are more electronics and they study, they achieve. But what is your body? See, we are all hunters. We are supposed to run around. We climbed the tree. Our ancestors climbed the tree. They are running around to save their life. They have been physically so active, and our physical activity is not that great. I recommend everyone to do some yoga, pranayam, breathing exercise, and keeping the mind calm. Do some game, like take up one game. You have plenty of place in all the colleges to play around. So do physical activity, very important. It makes you physically fit. It let you stress out, and you feel happy. Not only sitting all the time doing some work is the achievement is important. But what's life without moving the body, sitting in same place? But avoid heavy exercise right before bed. Don't do heavy exercise before going to bed. Avoid looking at phones, computer screens, or reading devices, e-books that give off light before bed. No, it stimulates your brain, affects the circadian rhythm, then you will not get into sleep. So don't look into this bright screen before going to bed. I always tell people that to put off your mobile. What is going to happen to your friend may phone you and disturb you for half an hour talking something which is not relevant to you. Sometimes you cannot say no to him because he will be angry with you. So put off the phone so that you know that you cannot be contacted after 10 o'clock actually, unless you are on duty, like on call, and you have to take care of the patients. And then what's the point in putting on the mobile for people to talk to you? What they are going to talk to you at 10 o'clock if they are not your patients or that is an emergency? It's a waste of time. No need to. If you're not personally, then nowadays I see people are not personally interacting. I have people say electronically interactable population. You speak to somebody through phone, he will talk to you for 30 minutes. You see him personally, you say, hello, how are you? You say, I'm busy, I'll speak to you later. I don't know how many of you notice this kind of people. They're quite often I see nowadays, they don't interact with you personally, but they nicely interact with you electronically. They are electronically interactable people. Don't join with that population. It's not good for you. This can make it harder to fall asleep actually. Like if you are going on looking at the screens and interacting, saying movie, then it will make you very difficult to get into sleep. So do not use alcohol as a sleep aid. People say that, okay, I'm not getting sleep, I'll drink something, then I'll get into sleep. And it's not a sleep aid actually. Even though alcohol makes you sleepy at first, it disturbs sleep later in the night. So people become restless later, and it affects their sleep much more than what they think about the use of alcohol as a sleep aid. So relaxation exercises, as I told that now our body is, we are all living in this world, we're born in this world actually. I like, we say, okay, we have become very mathematical people, calculation, achievement, all the data, and how I am going to be compared to others. We are in the rat race actually, very important. We have to be competitive. There's nothing wrong in being competitive. I think competitive among people, you achieve what you want. That's very important. At the same time that, you also make sure that you have to balance your life. So as initially I was talking about exercise to you, cycling, some yoga, playing a game, and relaxation exercise is progressive muscle relaxation. This involves progressively relaxing your muscles from your head down to your feet. I think yoga teaches that actually. As you would have seen that I have done my law, astrology and all those. Now I am doing yoga therapy, applying yoga for medical treatment. It's very interesting actually. Now I understood that how much we don't take bother about our body. We are not conscious of our body. The body tells you to sleep. The body tells you to eat. The body tells you that don't get angry. Everything the body is designed. It is tuned to warn you what is not good for it. But we don't listen to our body. We are not conscious of our body and mind. It's very important to be conscious of your body and mind. Diaphragmatic breathing. This is a deep breathing technique that can help you relax. Mindfulness. I think this, I was surprised to see these are all words used in yoga, but you see in international website, people are talking about mindfulness, taming of the mind. This involves trying to be present in the moment, aware of your physical sensation, thoughts, and emotions, mindful of yourself, mindful of your mind, and mindful of your body, mindful of your it is being, like caring about yourself and conscious of yourself is very, very important. So excessive daytime sleepiness. You may be seeing that, the lecturer giving class and giving lectures, and people say, oh, I'm bored, I'm not feeling like listening to him. I think boring lecture, or maybe that I feel very sleepy in the classroom. Then you have to sit and think why you are sleepy, why you are having excessive daytime sleepiness. Insufficient sleep is perhaps the most common and easily overlooked cause of excessive daytime sleepiness in patients with medical illness. High-risk group include shift workers, patients with competing family responsibilities, patients with chronic pain, and hospitalized patients. Every family has a problem. People fight with each other. They are angry. They are anxious. They are not happy with each other. There are family issues. There are relationship issues. But keep one thing in mind, that you keep yourself happy. As long as you are not responsible for somebody's unhappiness, you keep yourself happy is very important. You cannot solve all the problems in life. Our job is not to solve the problems actually. We should not create problem. It should be peaceful to us. That's very, very important. So always keep your mind calm actually. But these things are very common in shift workers. People work long hours, and people come home and then also they work long hours actually. You have to keep in mind that we are not machines. Even machines get repaired if it work too much actually. Keep balance your life, very important. So chronic sleep insufficiency, common in modern society. We call modern society performing society, and we are corporate society, and we are we are achieving everything. What is achievement? Okay, very important, but same time that balancing, as I told initially, is very important. Common in modern society result from variety of factors. Work demand. You have more demand. You work more than normal. Social and family responsibilities, medical conditions, sleep disorders. As sleep debt accumulates, I always tell that when you are not sleeping adequate time, then every extra hours of sleep will accumulate. It's called sleep debt. That is sleep bank. You have to pay back to the sleep bank. So individuals may experience reduced performance, increased risk for accidents and death, detrimental effect on psychological and physical health. It affects everything. You can't perform, you'll get into accident, your psychological and physical health issues. Sleep has two dimensions. As I was telling, some people sleep for long hours, but they don't feel fresh in the morning. The duration of the sleep and the depth of sleep, quality of sleep. Some people have fragmented sleep. They get up for 3 or 4 times in the night. They go to bathroom, they sit, they go to sleep. So it's called fragmented sleep. So both duration and depth of sleep is very, very important. Sleep intensity can change without major changes in sleep duration. So you may be having adequate hours of sleep, but sleep intensity is not good. Sleep duration alone is not a good indicator of how much sleep is needed to feel refreshed in the morning and function properly. So chronic sleep insufficiency is different from insomnia. So you should have to be very careful about the terms actually. Chronic sleep insufficiency is different from insomnia. People don't get sleep. Chronic sleep insufficiency is due to volitional partial sleep loss or insufficient opportunity to sleep. They like to sleep. They don't have time to. Some people say, oh no, he's very busy. You don't have time to sleep. You don't have time to talk. You don't have time to eat. I think something wrong with him actually. Don't appreciate that to yourself or to anybody actually. It's not the right way of living. So sleep deprived individuals will rapidly fall asleep if given the opportunity. You give them a bed and place to sleep, they'll sleep anywhere. Only because they don't have time to, they say time to sleep. Either they don't sleep because they have too many things to do. You can't do all the thing by yourself. You need people, you need a team. So a single person trying to take everything on his head and say that I'm the only person who can do it, then you'll get into all these issues. So you have to understand the importance of teamwork and sharing the work. Sleep deprived individuals will rapidly fall asleep if given the opportunity. Individuals with insomnia are unable to fall asleep actually, even though they feel fatigued during the day. That's the difference. Insomnia people don't get sleep. Chronic sleep insufficiency people get sleep if they given opportunity to sleep, but they don't sleep because they say they're too busy with too many things. So insufficient sleep syndrome. So that is an international classification of sleep disorders. The disorder characterized by excessive daytime sleepiness caused by curtailed sleep almost every day for at least 3 months. So see, these don't bother about 3 months, 6 months. These are all definitions given by a big organization. But you know that you don't sleep, and even though there is an opportunity to sleep, and you do things in sleeping time, and you want to do what you can do in 6 months, in 3 months time, you want to perform faster and shorter time. All these things, at the cost of your sleep. If you are able to do with good sleep, good food, some relaxation, well and good, but don't compromise on all these things. Alertness is normal if the person wakes feeling refreshed and is capable of moving through the day feeling alert without effort, even when placed in boring or monotone situations. If you are watching a boring movie, or maybe you are listening to something which we are bored about it, whatever it is, and usually if you're alert, you will not sleep actually. I think only some people have this quality. I think most of the people, even though they are okay, that they will sleep actually. If you are able to alert yourself, whatever the situation, then I think you have a very good quality of sleep actually. Your mind is fresh. There is surprisingly little scientific evidence to recommend a fixed amount of sleep hours. So what is some people feel fresh after 6 hours, some people fresh after 8 hours, some people don't feel fresh even after 10 hours. As I told, the quality and the depth of sleep is very, very important. So that you can't say people you sleep every day 6 hours is good for you. So very, very important people understand that even though the minimum hours of sleep is important, at the same time that the quality of sleep is equally important. American Academy of Sleep Medicine and Sleep Research Society recommend that adults sleep 7 or more hours per night on regular basis to promote optimal health. So they say, okay, you sleep 7 hours or more, then your sleep is good. Okay. So you have recommendations and you have definitions, very important, because for taking examinations and all those things, very important. As I told initially that you need minimum hours of sleep, and even if you sleep one hour extra, it doesn't mean, so 7 or more hours is okay. And they're telling that at least you spend that amount of time in the bed. Otherwise, people say that I've slept 4 hours, I'm feeling fresh. They propagate a wrong message to the society. And they say that, oh, this man sleep very less and you do extraordinary work. And I think you don't need sleep for performance. And I don't believe that actually. I know international body believe that. Whoever you are, whatever your capacity, whatever your intelligence, intellectuality, knowledge, everybody is human being. Some people may do better with little less, but not without that. So you need minimum amount of sleep for everybody to perform constantly or long-term performance. Population-based survey studies, more than 1/3 of adults report sleeping less than 7 hours per night on weekdays or workday nights. So they done a population-based study, like we recommend, we should tell what is good, what is not good. But what people really do in the society, then you need to do a survey study. They found that 1/3 of adults, 1/3 of adults do, 33%, they don't sleep adequately. So American Time Use Survey found that sleep time was most often exchanged with paid work time and commuting to and from work actually. Like they say, okay, I will pay you double the amount of money. You work another 4 hours extra because you may, for that money may be big for you, but that what the person get is much more than that. So that so don't sacrifice your basic needs for money. You work normal time. If you are being paid to work extra time, you pay double the amount you paid, you have to work another 4 hours a time. At what cost actually? Burning your body, burning your mind, burning your health. Be careful about that. Nothing wrong in as a doctor that we have night duty, all those things, then we have to go back to the room and sleep after that. Again, going back to room, not sleeping, eating and going around, and then not good actually. It's very, very important. Okay. So effects of acute sleep deprivation. So what are the effects of acute sleep deprivation? Cognitive effects actually. People don't sleep adequately. Their cognition comes down, memory comes down. They cannot remember things. As I told, they become cranky, irritable, angry. Mood and judgment. So that people mood will be altered. They will have fluctuating mood, and their judgment may not be perfect all the time. And sleepiness and micro sleep. Like the people may sleepy, the excessive daytime sleepiness, which I was telling initially, and they may get micro sleep attacks. For example, I'm telling you, most of you may be driving the car, you would have got your license. So a car driving 60 miles per hour will travel more than 250 feet during a 3-second micro sleep attack. So if you get a micro, people say that one of the commonest cause of accident, especially heavy vehicle accidents, the drivers don't take rest actually. They get a micro sleep attack, 3-second micro sleep attack. In the micro sleep attack, they can travel 250 feet. And if the road curves, the car stops in front of the car, a serious accident may occur. It's very, very important. 250 feet is not a short distance, and if there is a curve comes or car stops, some vehicle in front of the car, they will get an accident. A sleepy driver will either respond normally to an emergency or not at all due to rapid changes in the vigilant state and a sudden intrusion of micro sleep during waking. We think that immediately after waking that will become totally alert. It's not like that. Even while waking, they may get micro sleep attacks. So it's very, very important that if you are feeling sleepy, if you are not that feeling vigilant, constant attention is vigilant. If you're not vigilant, don't drive the car. Very, very important. So respiratory physiology. Sleep deprivation has been reported to depress ventilatory responses to hypercapnia and hypoxia in otherwise normal subjects. Sleep deprivation could contribute to hyperventilation in hospitalized patients. So if people don't sleep, they may get hyperventilation. They may be breathing less than normal. Circadian factor. There's something called circadian rhythm in the brain. So there are the circadian rhythm can be affected. And as I was telling initially, the sleep time may be and the response to the sleep deprivation may be inter-individual variation. Some people say, "Oh, I am fine." That why you are getting that? Don't compare yourself with somebody else. Your body is different from his body, so that it is very important that you understand your body rather than following a standard advice. And it's very, but the standard advice of most other recommendations applicable. But we should not say that okay, I can feel fresh even after 4 hours, but it's not a even if you're feeling fresh, you will have long-term impacts. It's better to have minimum hours of healthy sleep. Cardiovascular morbidity. In 2016, scientific statement from American Heart Association, they mentioned that sleep restriction is recognized as a risk factor for adverse cardiometabolic profiles and outcomes. I seen one top executive of an organization. He had some problem in the organization. He not slept for seven days continuously because he has to solve the problem. 8th day was found dead in the bed. I think we always think, oh, the stress can kill. I will tell you what are the effects of this kind of acute sleep deprivation. Sleep restriction is recognized as a risk factor for adverse cardiometabolic profiles and outcomes. Healthy sleep behavior is recommended to promote ideal cardiac health. Short duration of sleep has been associated with a burden of subclinical non-coronary atherosclerosis. They found there is a thickening of the vessels in short duration of sleep deprivation. And in one large studies, in one large cross-sectional study that included nearly 4,000 adults and 40 to 54 years of age without a history of cardiovascular disease or obstructive sleep apnea, those with shortest sleep duration of 70 on actigraphy. Actigraphy is something what's like thing in the wrist, and it will pick up how you are sleeping. And increased atherosclerotic plaque burden as measured by carotid and femoral vascular ultrasound. So in a large study, they found that people have this kind of a short duration of sleep deprivation. They found plaque appearing in a short duration. They found by carotid and femoral vascular ultrasound. Poor quality of sleep can produce arrhythmogenic effect on the heart. So suppose if somebody is not slept because of stress, too much work, and suddenly they can get arrhythmia in the heart. So very important, sleep is important for cardiovascular health. They don't sleep adequately. Even a short duration of sleep deprivation and massive sleep deprivation can produce atherosclerotic changes in the vessels, and poor quality of sleep can produce a arrhythmogenic effect of heart. So immunosuppression, people don't sleep adequately. The immunological system will not be that effective. So they're prone for infections and other issues. And obesity and metabolism. We always think that obesity is something lack of exercise and people are eating too much. It is not like that. It is a metabolic syndrome. Multi-observational studies have demonstrated an association between short sleep duration and obesity. So if people are sleeping in the wrong time, short time, and chronically sleep deprived, they are prone for weight gain. So all cause of mortality, it has been suggested that there is a U-shaped association between sleep duration and mortality risk. One large prospective study found that self-reported short sleep duration was associated with the increased rate of decline in the renal function over an 11-year follow-up period, independent of established risk factors for chronic disease. So keep in mind that it has effect on your heart, it has effect on your kidney, it has effect on your psychological and physical health, it has effect on your cognition. So it can produce any issues in any organ in the body. Sleep is so important. It's not purely rest. It is a process. The biochemical industry. A lot of things happens during sleep. So I'll come to a conclusion. A healthy sleep is very important. Deprived sleep is a sleep debt actually. So you have to pay back the sleep bank. Maybe in the exam time, maybe you're sleeping 1 or 2 hours less actually, but if you're studying every day, you can avoid that. But if there is you need 1 or 2 days, then get back that sleep, pay back the sleep debt to the sleep bank. A healthy lifestyle is an important aspect of preventive medicine. There's no point in allowing for people to get disease and treating them. We are becoming more acute care physicians actually. That's not the way medicine should be. Our main aim is to prevent the disease, make people healthy. Still they get some illness, then we can treat actually. It's not about doing too much work and becoming too busy in life. It's about preventing the problems, then treat whatever still comes in spite of all your effort of preventing it. An achievement has a value only if we live longer. No, like we see that we want to achieve short-term hard work and all those things. Sometimes important to perform in competitive world, but you have to get back all the thing what you lost, and you have to constantly and you have to live a healthy life. And unless we live longer, our achievement has no value. It has no meaning. Have a healthy sleep and live a balanced life. So clean habit, healthy lifestyle, and planned work, loving the profession as having a passion for the profession, so that you feel happy, because it's a long-term journey. Medical journey is a long-term journey. Enjoy every day, every moment, and you will never regret it in your future. Thank you very much for listening to me. I finished the talk, Sanjay.
Thank you, sir. That was very motivating for the newcomers. And I think